Good day, class. In this video, we are going to talk about the bladder and the kidney. The bladder stores the urine, and this is urine. The formation of the urine will need assistance from the kidney yang. So previously in the diagnostics, we have discussed the relationship between the bladder and the kidney, as well as the formation of the urine. So the disorder of the bladder will mainly focus on the abnormal urine or abnormal urination. The urine is a kind of water. So the bladder problem, the problem related to the urine or urination, will also focus on the water metabolism. When we're talking about the water metabolism in the body, it will link to the lung, the spleen, the heart, the 三焦, the small intestine. The small intestine, from the function of the small intestine, it needs to separate the water and the food. The 三焦, why 三焦is related to the water metabolism? The 三焦is the pathways of the qi and blood. The 三焦also the pathway of the water. So anything related to the water metabolism, including the urine, we're going to focus on the 三焦. So the key organs that related to the bladder will be the kidney, the lung, the spleen, the heart, 三焦, and small intestine. Especially the 脏 organs, the heart, the kidney, the lung, the spleen, and the heart. The syndrome differentiation, we only introduce two types of bladder syndromes: the deficient cold syndrome and damp heat accumulation in the bladder. These two we use as an example to help you to identify the symptoms as well as the application of the acupoint. These two symptoms are actually in the opposite direction. One is the coldness, deficient coldness. The other one is the excess heat. Deficient coldness. It is a deficient syndrome. The patient will suffer from frequent urination, clear color. Also, sometimes the patient may present as lost control of the urine, difficult urination, edema, pale tongue, moist coating, deep and firm pulse. Because this is a cold syndrome, in the treatment principles, we try to warm the yang qi. This yang qi can be the bladder, it also can be the kidney. As we mentioned, the formation of the urine, the kidney yang qi plays a very important role. We also need to promote the bladder function. So we're going to use a combination of acupuncture and Moxibustion, reducing technique. We're going to focus on the Liver Meridian, the foot tai yang meridian. The foot tai yang meridian is the bladder meridian. The Liver Meridian, especially the points that's in the lower abdomen, these are local points. Room 3, room 4, room 6. And then bladder 23, bladder 28, kidney 3, spleen 6, stomach 36. Bladder 23, 肾腧, 肾 is the kidney. Bladder 28, 膀胱腧, 膀胱 is the bladder. Kidney 3, the yuan source point of the kidney, 三焦, 三阴交. The spleen 6, 3 in meridian, cross on spleen 6, they meet here. Damp heat accumulation in the bladder. Because of the damp heat, the patient will present a frequent urination, sometimes also painful urination. Scant urine, dark yellow color, sometimes even with blood or mucus or pus or mucus in the urine. The stone, the kidney stone, the bladder stone in Chinese medicine also considered as the damp heat. So some patients also may present as hot sensation in the external genitalia or pain in the area. Red tongue, yellow coating, rapid pulse. The human principles, we need to clear the damp heat and block the lower jaw. So because of the clearing, you want to move something, reduce something. So we're going to use acupuncture, reducing technique. We're going to focus on the Liver Meridian, also the local area, the foot Tai Meridian, the foot Tai Meridian. So we can focus on room 3, room 4, bladder 40, bladder 39, bladder 23, bladder 28, 27, 22, spleen 6, spleen 9. When you see the functions of these points, some are local, some are related to the yin, so that can help to reduce the heat. Some are specifically focused on the bladder. Bladder 22, 三焦枢, 三焦 is the 三焦, the organ of 三焦枢, that's similar to the Zhang's organs on the bladder meridian. 27, 小肠枢 is the points of small intestine. The kidney stores the essence. The kidney in charge of the bones and marrows. The kidney also receives the qi. The orifice of the kidney is in the ears and the external genitals and anus. So the dysfunction of the kidney, the disease is related to the kidney, will present in these organs or these location or the tissues. The kidney governs the water. The kidney also stores the essence. This essence is the innate, the most original essence. The kidney stores the yin and yang, the roots yin and root yang of the body. So the kidney, especially the kidney yin and kidney yang, is very important for the yin and yang in other organs. Kidney yin deficiency. The patient may present as dizziness, vertigo, tinnitus, dry throat, dry tongue, feverish sensation in the palms, insomnia, spermatorrhea, irregular menstruation, night sweat, weakness in the lower back and knees, red tongue, less coating, thin rapid pulse. Some patients, due to the congenital deficiency, the patient also may present as a slow development, slow body development, slow brain or the intelligent development. So these are related to kidney. In adults, patients also may present as infertility. No matter in male or female, they may present as infertility. From the lab test, from the male, from the sperm routine test, sometimes you can see the less sperm, less active sperm. In female, you can see the patient may present as amenorrhea. There's no menstruation at all. Because of indeficiency, firstly, it's deficiency, so we need to tonify. We want to add something to the body, so that's reinforcing. So we can use acupuncture with reinforcing technique. Because of indeficiency can present as deficiency heat, so we will use less moxibustion. We can, but less. We're going to focus on the first Shaoyin kidney meridian and the backthrough points. Kidney 3, kidney 6, kidney 1, kidney 7, 12, bladder 23, bladder 15, room 4, spleen 6, bladder 32, bladder 54. Similar to previous discussion, all these points, some are local points, such as 32, 54, bladder 15, 心腧. Xin is in the heart backthrough points. Why we use the 心腧is because we want to regulate the function between the heart and the kidney. When we discuss in the basic theory, we have discussed one situation, the disharmony between the heart and the kidney. So we can use bladder 15 and bladder 23 to harmonize the heart and the blood. Yang deficiency. The kidney yang deficiency falls in the category of yang deficiency. So this patient may present as internal coldness. One of the key manifestations of yang deficiency is internal coldness. So the patient will present as the spermatoria, pale complexion, cold extremities, or premature ejection, erectile dysfunction, so the male's problem. In females, they may present as irregular menstruation, the weakness or tiredness in the waist and the knees, loose stool, diarrhea, especially the diarrhea at dawn, so in the early morning. Clear urine, pale tongue, a pale tongue, a white coating, and slow, deep, weak pulse. The patient also may present as less urination and edema. The patient may present as difficult breathing, tachypnea. This is due to the receiving function from the kidney. In the treatment principles, we're going to use the principle of wounding the kidney, receiving the qi. The receiving qi we try to recover the function of the kidney. So in the treatment, we're going to use the combination of acupuncture and moxibustion. We're going to use reinforcing technique. We're going to focus on the foot Shaoyin meridian, Liver Meridian, and the related backthrough points, such as kidney 3, kidney 7, 12, room 6, room 4, bladder 23, bladder 13, 20, spleen 6, 4, stomach 36, etc. Many of these points we have mentioned previously, and especially because of the yang deficiency, we can focus on the moxibustion. So we can use the moxibustion for these points. The sanjiao is one of the most difficult organs that's in the basic theory. Because we always talk about the sanjiao, we always focus on the functions of the sanjiao. However, we don't know, or we can't actually see where sanjiao is. We always say that sanjiao governs the qi of the whole body, governs the qi, the pathway of the water metabolism. So the dysfunction of sanjiao may present as the dysfunction or disorder of qi and water. The sanjiao, the upper jiao, the lung and the heart, the middle jiao, the spleen and the stomach, the lower jiao, the kidney and the bladder. All these organs that are related to the distribution, the metabolism, and also the qi, blood, body fluid distribution. So the dysfunction of sanjiao may affect quite broadly in different areas. Sanjiao deficient coldness. The sanjiao deficient coldness is actually very similar to the kidney yang deficiency. The patient will present as yang deficiency. The yang deficiency will result because the sanjiao is related to the water metabolism, the pathway of water. So when we talk about sanjiao, we are more focusing on the qi circulation and the water circulation. The water will, when we talk about the water, the patient may present as edema. This edema can be the edema under the skin or in the feet. The patient also can have edema in the abdomen, difficult urination, lost control of urine, white greasy coating. The pulse can be deep, thin, and weak. The treatment principles, we're going to warm the sanjiao, promote the qi transformation. So as you can see here, when we talk about sanjiao, although we don't see where is sanjiao, our treatment, we're going to focus on the qi and water. So we're going to use the combination of acupuncture and moxibustion. We're going to use reinforcing technique. We're going to focus on Liver Meridian, related back 2 points, room 6, 4, 12. Sanjiao 4, kidney 3, spleen 6, bladder 23, bladder 22, stomach 36, etc. Room 6, room 4. These two are very important to create the heat in the body. Room 12, zone 1, is also the meeting point of the organs, the full organs. Zone 1, room 12, also locates in the middle jiao. So when we're treating the sanjiao diseases, we're going to focus on upper jiao, middle jiao, and lower jiao. Room 6 and room 4 locates in the lower jiao. Apart from these points, you also can choose Panzong, so the points on the chest, on Liver Meridian, in the upper jiao. The excessive heat in the sanjiao. This is due to the excess heat, the accumulation of the excess heat, and then in the meantime, it results in the dysfunction of water metabolism. So the patient will present as fever, or may present as fever, thirsty, tachypnea, edema, dry stool, difficult urination, yellow coating, slippery, rapid pulse. We're going to, because of the excess heat, we're going to use acupuncture only. We don't use moxibustion. We're going to reducing technique. We're going to focus on the Liver Meridian, the hand Shaoyang Meridian. So we're going to choose zone 12, zone 3, zone 9, zone 5, stomach 28, sanjiao 4, 6, spleen 9, spleen 6, bladder 40, stomach 36. After all these discussions, I assume that you will realize that some points are very commonly used in the heat. In the heat syndrome, some points are very commonly used in the deficient or yang deficient or internal coldness or coldness syndrome, such as the bladder 40, spleen 9. These are very commonly used in the excess heat syndrome to relieve the heat. 三焦 6, 支沟. This is a specific point for constipation. 人 12, 人 3. These are the local points in the abdomen. 人 9, 水分 水 is the water. 分 we're going to separate. 分 is dividing. So it means that these points can separate the water we can use for edema. We're going to separate, divide the water. Stomach 28, 水. Again, S-H-U-I, 水. When you see 水, it means water. 水道, it means the pathway of the water. Stomach 28. So we also can use stomach 28 for edema. The liver governs the distribution. The diseases related to the liver are more likely to be accessed, especially the qi stagnation, and results in the liver fire. The liver fire, especially the deficient fire, also can be the result from the kidney insufficiency, because the kidney and liver are all in the lower jaw. The kidney is the water, the liver is the wood. The two are also related together. The disease from the disease of the liver from the kidney, we say that it is due to the deficiency of the kidney. The water cannot nourish the wood, so the kidney problem may affect the liver. The liver also stores the blood. It opens in the eyes, the orifice. So the liver problem, the patient also may present as something in the eyes, such as the blurred vision. The liver links to the ligaments and tendons. The liver meridian, the distribution of the liver meridian, you see it circles in the external genitals, the local area. So the liver problem also very closely related to menstruation, male's problem, to infertilities. So for infertilities, we're going to focus on the liver and the kidney. The common symptoms of the liver problem, the patient may feel distending sensation in the chest, oppressed chest, nausea, vomiting, dizziness, vertigo, the spasm in the extremities, or the cramps, irregular menstruation. Gallbladder and the liver are the coupled organs. The main function of the gallbladder is something related to the bowels. If the gallbladder, the function of the gallbladder is affected, the patient may present as jaundice, bitter taste in the mouth, vomiting, especially vomiting with bitter substance. The stagnation of the bile also can result in the stagnation of the liver. Then the patient may present as similar manifestations, such as the dizziness, vertigo, oppressed chest, insomnia, irritation, or bitter taste in mouth. So as you can see, these two are quite similar, the diseases related to the liver and gallbladder. So in the treatments, although in the syndrome differentiation, we separate them clearly, but in the clinical practice, sometimes it's not easy to separate them. The first one, the liver qi stagnation. The liver qi stagnation, the patient may present as the depression. The patient prefer sighing. After sighing, they feel better. So when you see a patient, you will see that the patient always, when you see this kind of symptom or this kind of signs, you see that this patient actually feel better after sighing. This is after sighing, the exhale of actual qi can relieve the qi stagnation. That's why the patient feel better. The patient also may present oppressed chest, stomach ache, poor appetite. In female, irregular menstruation, painful menstruation, and this one of the very typical symptoms in females. Before the period, they can feel this tending pain in the breast. This is a very typical symptom for liver qi stagnation. The reason for the symptoms is also because the liver meridian distributes in the chest. The treatment principles activate the liver qi. We're going to activate the qi stagnation, the qi circulation. We're going to use acupuncture, reducing technique because of stagnation. We're going to focus on the liver meridian, foot J meridian, level 3, level 2, 13, 14, pericardium 6, GB 34, stomach 36. Why pericardium 6? As we mentioned in the previous videos, pericardium 6, we can use pericardium 6 for anything related to the chest and stomach. GB34, the ligament meets at GB34. So these points have specific function. These are actually specific points that have different categories. Level 3 is the yuan source points of the liver meridian. The yuan source points in the yin meridian also the Su points. So that's why the level 3 we use quite often. The level 2 also a point in the five Su points. They have specific function. The internal stirring of liver wind. Where does the wind come from? So when we talk about the wind, we need to think about something moving. What's moving? The patient may feel dizzy. There's something moving. The patient may feel trembling, numbness in the hands or feet. The patient may present as fever, unconsciousness, spasm of the extremities, spasm of the muscles in different areas, different parts of the body. The deviation of the tongue, the red tongue, the deviation of the tongue also kind of spasm. It only spasm at one side. That's why the tongue becomes deviated. Red tongue, a wiry pulse. In the treatments, we're going to expel the wind, stopping the spasm. It's very important we identify where does the wind come from. The wind either from liver heat, liver fire, or liver insufficiency, or liver blood deficiency. So now you need to revise the contents in the basic theory for the internal evils. The 5 internal evils. What are they? And what are the causes of those internal evils? In the treatments, we're going to expel the wind and stopping spasm. We're going to use acupuncture only. Reducing technique. we mainly focus on the foot Jian and Liver Meridian. We're going to use level 3, level 2, do 26, 20, 14, do 8, large intestine 4, and 三焦 3. Sorry, small intestine 3. Level 3, again, we use level 3 and large intestine 4 together. These two can assist the activating the circulation. Level 2 is the Xing points. Xing, the 5 Su points. Do 26, 水沟. We're going to use this a lot for consciousness, for reducing, for purging of the pathogens in the body. Do 26. Do 20, 百会. 百 means 100, 会 meeting. Something meeting here. This is on top of the body, on top of the head, the points. 大椎, do 14. The yang can meet here. The yang meridian meets here. Yang qi meets here. So we can use these points to relieve the heat, especially if the wind due to liver fire. 经缩 do 8. 经 is the ligament. 缩 means contracted. So we can use do 8 to relieve the ligament congestion, which is the spasm. Do 8 also can be used for throat and shoulder. We have mentioned previously the throat and shoulder. We use the point on the leg. We use that one to treat the throat and shoulder. Now we can use do 8 to treat the throat and shoulder, because the throat and shoulder, one of the manifestation is the limitation of the movements. The limitation of the movements, no matter what kinds of inflammation, what we see is the ligament doesn't open that well. It's not flexible enough. So in other words, the contraction of the ligament, the ligament contracted. So we can use do 8. Hyperactive liver yang. Hyperactive liver yang, we have to clarify here now the hyperactive liver yang and liver fire. What's the difference between these two? We try to use different terms to clarify the difference between excess and deficiency. Hyperactive liver yang means you got too much liver yang. However, this liver yang is due to deficiency. Due to the liver insufficiency, you got a relatively excess liver yang. The liver fire is an excess syndrome. So when you see hyperactive liver yang, whenever you see hyperactive is a deficiency. Insufficiency results in deficiency heat. Liver fire is an excess syndrome. The manifestations of these two sometimes are quite similar. The patient may present as headache, dizziness, distending sensation in the eyes or in the chest, irritation, bad temper, feel angry easily. The tongue may be slightly different. For the hyperactive liver yang, the patient may present as red tongue, while repulse. For the liver fire, still red tongue, while repulse, the yellow coating of the tongue. For the hyperactive liver yang, the patient will have less coating because this is due to liver insufficiency. In the treatments, we're going to focus on no matter what kind of cause the patient presents as liver yang, hyperactive liver yang, or liver fire. There's some types of heat. So firstly, we're going to reduce the heat, and then we also can at some points for the root causes, such as to tonify the kidney yin. But to reduce the heat, we use quite similar points on both level 3, level 2, kidney 3, kidney 1, kidney 6, bladder 18, 23 to 20. Kidney 1 under the other soul is quite painful. So if you, especially for acupuncture, if you can avoid, try to avoid kidney 1. If you have 2, especially for kidney yang deficiency, you can use the Moxibustion on there. For liver fire, very similar, but you can add GB 43 actual points on the head and neck, 5, actual 3. The cold retention in the liver meridian manifests as the contraction, especially in the lower abdomen. So the patient may present as the distending feeling or distending pain in the lower abdomen. The patient also in male, especially in male, it also can present as the pain in the testicles. White slippery coating, deep wide repulse. In the treatments, we're going to warm the meridian and expel the coldness. In treatments, we're going to use the combination of acupuncture and Moxibustion because this is a cold syndrome. We're going to use reducing technique because the cold retention is an excess. We're going to focus on the foot J meridian, level 3, level 2, level 1, 12, room 4, 29, spleen 6, GB 34. The liver blood deficiency, the patient presents as the dizziness, vertigo, dry eyes, because the eyes are the orifice of the liver, blurred vision, night blindness, or short eyesight, tinnitus, the numbness in the numbness in the feet or in the fingers. In female, the patient may present as less menstruation or the less volume of the menstruation, or even amenorrhea. Pale tongue, less coating, a thin wide repulse. In the treatments, we're going to tonify the liver blood. The combination of acupuncture and Moxibustion, this is the deficient syndrome. So we're going to use reinforcing technique. Many focus on the 3 foot meridians and the backthrough points. Level 3, 8, kidney 3, kidney 6, spleen 6, spleen 10, GB 37, bladder 18, 23, stomach 36. Stomach 36 is commonly used for general health to improve the qi of the body. 23, 18, 肾腧, 肝腧, the points related to the kidney and the liver. 光明, again, sometimes we introduce the Chinese name. GB 37, 光明 means brightness. What's brightness? This in the body, that's the eyes. 光 is the light, 明 is the brightness. So you can see the light. That's something related to the eyes. This patient got blood deficiency, so we can use GB 37. Spleen 10, 血海, the sea, from the name, this is not a sea of the blood from the theory, but from the name, 血 is the blood, 海 is the sea, so we can use for blood deficiency. The liver fire and gallbladder fire are very similar. For diseases that are related to the gallbladder, we mainly focus on the distribution where the gallbladder meridian distributes, such as on the sides of the body. So especially such as the tinnitus, something related to the ears, migraine, also one side of the body, death, also related to the ear. The bitter taste also can related to the liver. In the treatments, you can use GB20, GB24, GB40, GB34, 41, 43, level 2, level 3, 14, Sanjiao 5. As you can see here, no matter the level of gallbladder, our treatments mainly focus on the liver and gallbladder. The damp heat in the liver and gallbladder. In this situation, this is also an excess syndrome, dampness and heat. Because of the dampness and heat, so this patient may present as something heavy due to the dampness. The dampness will block the qi circulation, so the patient will present as oppressed chest, distending pain, yellow eyes, yellow body, yellow urine, or jaundice. The patient also may present as itching sensation in the external genital area. In male, the patient may present as the distending pain in the testicles. In female, it will present in the leukorrhea, such as the yellow, smelly leukorrhea. The tongue may present as yellow greasy coating, wiry, rapid pulse. The treatment principles: smoothing the liver and gallbladder, clearing the heat and dampness. Because of excess syndrome and excess heat, we're going to use acupuncture. We don't use Moxibustion. We're going to use the reducing technique. Focus on the foot Jue meridian, foot Shaoyang meridian, Tai meridian. Level 3, level 2, 13, 14, GB24, GB34, spleen 9, 6, blood 18, blood 19, 20, 36. This is the last syndrome we are going to introduce as examples in the Jiangfu differentiation. As you can see, we try to identify the more better, or we try to identify the clearer the better of each syndrome. But from the treatments, you will see we actually use similar points for the treatments. The reason is because as long as the cause are similar, we can choose similar points, and some points have specific function to relieve the heat. So we can use for all kinds of heat, and then more specifically, you can choose the one that are related to the specific organ, such as the Yinlingquan, the spleen 9, GB34. These are the meeting points of something. So what's that something? I want you to find the answer. Where does it meet? And then you can, once you remember, next time when you see a patient, even not damp heat in the liver, maybe damp heat in the stomach, but the patient also presents as similar manifestation, you also can use. So these are the functions, special functions of specific points. In these few videos, we mainly discuss the syndrome differentiation as well as the application of acupoints according to the Jiangfu differentiation. After these examples, I hope that you will have a general idea how to choose the acupoints for the treatments, how to choose the acupoint for specific syndromes. In the next video, we are going to introduce the syndrome differentiation according to the qi and blood syndrome, or the qi and blood syndrome differentiation. Thank you for your attention.